Hello and welcome. Today is a difficult topic. We are talking about what happens in the body when someone is dying from dementia, that end stage of life. The signs and symptoms that your loved one or the person you're caring for may be reaching the very end of their life. And we're going to talk about what's happening in their body and what you as a caregiver or a loved one can do. What you can do to prepare yourself and your loved one for that final part of their life story. It is a difficult topic and it is a question that I do get asked a lot, and I think it does help prepare people. I think preparation reduces the fear of this last stage of life, and knowing what you can expect will be comforting to you. It should not be a fearful or scary process. It just should be one that allows us to spend some really intimate and beautiful moments with the person we care about as they transition from this life to the next. In a large percentage of cases, the person with dementia is going to pass from a complication or another condition other than the dementia itself. As the dementia progresses, the person's ability to cope with infections is severely reduced. This makes them vulnerable to bacteria and viruses, and illnesses like cellulitis, urinary tract infections or UTIs, and pneumonia will increase and can have fatal consequences. Muscle control will be weakened, so standing or even sitting, toileting and eating will be compromised, and conditions like bed sores, falls and fractures, and swallowing can become life-threatening conditions or problems. Indeed, a percentage of late-stage dementia patients will die from things like dehydration or chest infections or aspirational pneumonia. So aspiration is where the person will choke on their food due to compromised capacity of their swallowing reflex. Additionally, people with dementia often have comorbidities such as heart disease, hypertension, diabetes, or chronic respiratory illnesses, which increase the likelihood of further complication and death. So how will you know if someone is possibly close to death with dementia or a related illness? Well, there are some signs and symptoms you can be looking out for. A profound weakness, so the person may not be able to stand up or even sit up. They may slump or fall to one side. They may start to change their eating or drinking behaviours or not eat or drink at all. There may be reduced consciousness, or you may see the person sleeping a lot more than usual. There may be an altered physical appearance. You may just look at them and think they don't look the same. There's something different about their facial features. They may be coughing or making noises. This is perhaps related to their inability to swallow and their swallowing reflex. They may be experiencing visual or auditory hallucinations. They may become bedbound completely. And they may also be disoriented or agitated. I guess one of the problems here is that people in the advanced stage of dementia may already be exhibiting some of these signs and symptoms, which makes it more difficult for us to determine whether they are progressing into an end-of-life stage or whether it's a continuation of the dementia itself. Perhaps the most critical part of the dying process is that the body's organs are beginning to shut down, and there will be a clear reduction of consciousness that is observable. What is known as terminal restlessness. These are obvious changes in the body's state where the person may become very agitated, may be acting in a way that's unusual and different to their norm or baseline state. There may be obvious changes in their breathing patterns, and the breathing may become gurgly or rattly, and this is often noticeable in the last days or hours of life. If your loved one is entering this last stage of life, it's important to keep them comfortable, to be with them, to hold their hand, to talk to them, to gently wet their lips, to keep them warm, and consider their position in bed, maybe raise their head a little or change them to their side. Speak to a medical professional about medications for comfort, for pain if that is an issue, and possibly to dry up secretions, which you may notice in the last stage too. They may tend to dribble or their eyes may become wet and look like tears. But the main thing is just being with your loved one through this transitional process. There is some evidence that hearing is one of the last senses to go, so speaking words of comfort and allowing this process to be one of calmness and love and intimacy. Death is part of life, and it can be a beautiful process and one of comfort and even healing for those that are left behind. As the end comes, the heart rate and the blood circulation will begin to slow. The brain and the organs will be receiving less oxygen than they need. So this will mean that they'll start to shut down and not function properly. There will be a loss of consciousness, and as a result of this, the person is not necessarily suffering or experiencing pain. They're in an altered state of awareness, and it is common for people to become very calm before they die. Sometimes the opposite is true, and they may even become more alert and aware, a moment of unexpected improvement. This is something we call terminal lucidity, and it is a moment that can be confusing to caregivers, but it sadly is often short-lived. It's temporary, and it's a sign that death is imminent. In these last few hours of life, if you're not prepared and you're not sure what is to come, it can be stressful, it can be scary, and it can be unfamiliar. So things that you might want to consider are that your loved one's temperature will drop, their circulation is reducing, so they may be cold to touch, especially their hands and their feet. Their eyes may glaze over, and I mentioned their eyes may also become teary. This is not crying, this is not distress, it's the body producing secretions, it's part of the death process. And you may notice their colour changes to a mottled bluish purple tinge on their skin. You may hear a gasping of breath. There's a name for this. We call it Cheyne-Stokes or agonal gasps, which are the last reflexes of a dying brain. Often this is due to cardiac damage or myocardial infarction, but it is part of that last process, and whilst frightening to those unaware or unprepared, it is a very normal and often painless experience for the dying person. Keep in mind that the dying process is unique to everyone. This is a guide only. Similarly, how we cope to death, to watching a loved one pass, is unique and different to everyone. There are no absolute right or wrong ways to handle a situation like this. For some, it can be deeply distressing and upsetting. For others, it's a sense of relief that the loved one is finally at peace and free from the confines of what is often a horrible and long and enduring illness. If you feel like you need extra help or support through this, or some of this content has been upsetting to you, please reach out. That's why I created the Facebook Caregivers Support Group, so that we can all be there with each other through all the different challenges that dementia brings. Part of the reason why I was prompted to do this video, aside from a lot of the questions that I get over the years, is that I think my mum is moving into this end stage. And whilst I know what to expect and I'm as prepared as anyone could be, I still think there's really nothing you can do to completely be prepared for that final breath. And it is a very upsetting and very difficult situation. Even though you know your loved one is free from the pain, free from the suffering, free from an illness that has robbed you of them for many years, it is still a difficult situation, and it is something that you don't have to go through alone. Remember, death is not the opposite of life. It is the end of life. It's part of life, and it's something that we all have to be prepared for at one point or another. And though it is inevitable that at some stage our loved ones will all be gone from our sight, it is also true that they are never gone from our memories and from our heart. They will reside there eternally and until the day we ourselves take our last breath. Till next time, take care of yourselves and each other, and as always, I wish you a peace-filled day. Bye-bye.